Kanlong ka jingmantoy ka bakrawi ki bedone ka jingpang Klongsnam namar ka Neigrihms kala Wanrah ka jila Meghalaya ka project ka ban ai jerap ki bakum kini ki nongpang khamtam mi ki tu ki bawan ki longyeng ki baduna ka yo ka kon Yagani ka project latip kum ka ICMR STEMI Act project balapli ka alpasauterik mentau benai du menteri ka tanat koi ka khia James ke sangma ha Pinewood Hotel Shillong ha bakran ka ni ka sngi James sangma ulai ka jero ka Neigrihms ka Wanrah ka ni ka project ha ka jila Meghalaya bar ka ban ai ka jingmantoy bar ka jing shakri ya baro ki badon yagani ka jingpang.
This is indeed a really proud moment for me as Minister in charge of Health, Government of Meghalaya. And I would like to first and foremost place on record our sincere thanks to Professor Neigrihms and his entire team at Neigrihms, ICMR, and also of course our officials and our doctors of the Health Department for to borrow the words of Professor Mehta, to bring about this marriage of technology and medicine and bring forth this intervention which I have full belief and faith that this will bring about an environment which will save so many lives in the future.
Ula pentip bagi hospital ki ban tray ka mahpo kani ka project ki dan pratali ki bakinthup ka civil hospital Shillong, Ganesh Das Government Maternity and Child Health Hospital, Reed Provincial Chest Hospital, Dr. H. Gordon Robert Hospital, Nazareth Hospital, Woodland Hospital, Supercare Hospital, Barka Bethany Hospital. U Dr. Nalin Mehta, U Director Jongka Neigrihms, habakran hakani ka sngi ula pentip bakani ka project kan ai ka jing chakri ka babiang por ki bayo heart attack da ka bapen kloy ka jing ai jing sumar ki dawai ki pratip kum ki clot basta ki babone ki pai ba kimla ban cot bor namar ka jingram ka dor jong ki dawai hindrai hapo kani ka project yakini ki dawai on IA claim the don kam jing CUAA.
The Department of Health has been extremely cooperative. We have had support from 8 hospitals within Shillong to serve the people of Shillong. And this medication, which is to be expensive otherwise, will benefit especially those who can't afford it. I would reiterate that when somebody has a heart attack, some of which can be treated through intervention but some require this medication, unfortunately because of the time taken to reach the hospital and also some patients not being eligible for thrombolysis, despite the expensive medication, they do not get the benefit because at times they reach hospitals where they may not have a cardiologist at hand immediately. Now, technology marrying with healthcare delivery here, where immaterial of whether a cardiologist is present or not, the minute a patient reaches a hospital, the ECG is taken by the technician there. Every hospital has an ECG machine, even a primary health center can. That ECG record through this dedicated app is sent to Neigrihms, where our cardiologists are available 24/7, round the clock. The minute the ECG comes, they analyze the ECG and tell the peripheral spoke whether this patient merits or does not merit the thrombolytic agent. And if the patient merits, then the thrombolytic agent is administered within minutes. So it takes just that transfer of the app, the ECG on the app and the decision taken in minutes. So within the golden period we can save many lives.
Wiki Bla Jinkran Hakaniki Kilo Dr. Amit Malviya, Principal Investigator Jonkanika Project, KMN Nampui, Commissioner and Secretary Jonka Health and Family Welfare, Kakong RM Kurba, Secretary Health and Family Welfare, U Dr. Aman War, DHSMI, Barkiweki Bede.